No one wants to be in pain. No one wants their spine, their discs, their tendons, ligaments, and joints to degenerate. But what are you doing about it? And what can you do about it? First, let's talk about what people usually do when they are in pain.
Over-the-counter pain medication is usually the first step when people experience discomfort related to a musculoskeletal issue, closely followed by a visit to their primary care physician, who typically prescribes even more pills to address the pain. Some choose massage therapy, acupuncture, or a chiropractic adjustment to make the pain go away, but the root cause of the pain remains unaddressed.
So all of these things only treat symptoms. And you may also ask, well, I'm not currently in pain. I don't have neck pain or low back pain or any kind of joint pain. Why do I need strength training? Well, let's go into that now.
Many joints in our body are extremely prone to injury and degeneration without regular maintenance. These joints include the many that make up our spine, the shoulder joint and the supporting rotator cuff, the knees, and the hip joints.
It's likely every single one of you guys has experienced a problem in one of these areas over the course of your lifetime. So why are these areas so prone to injury and degeneration?
Supporting joint connective tissues, including cartilage, tendons, ligaments, and spinal discs, receive less blood flow. Without regular maintenance, these areas receive fewer nutrients, causing them to be prone to degeneration and injury. When injured, healing can be very slow. These joints are also more mechanically unstable, requiring healthy connective tissue for proper support. The shoulder includes two separate joints and has a large degree of range of motion. Our knees are made up of a hinge joint that can't tolerate twisting forces. The hip, a ball and socket joint, has a large degree of range of motion while at the same time supporting a great amount of weight. Our spines are very complex, containing 23 spinal joints with discs and an additional 2 facet joints for each spinal joint. That's a lot of joints. These joints are subjected to large forces and protect extremely sensitive nerves and our spinal cord. Without regular maintenance, a lot can go wrong here.
We also need to understand arthritis and what causes it, as well as why your body at times will create bony overgrowth in areas of mechanical stress, as well as why at times it will thicken and calcify ligaments.
Arthritis is defined as painful inflammation and stiffening of the joints. Weak joints are especially prone to wear and tear degeneration, which can cause inflammation, bone overgrowth, and stiffening of supporting connective tissues. Some examples include spinal stenosis, knee meniscus degeneration, and bone spurs. Ligament and tendon calcification and fibrosis are due to inflammation caused by weak joints, unhealthy connective tissues, and injuries that have not been properly rehabilitated. Without proper rehabilitation, scar tissue is formed using calcification and inelastic fibrotic tissue in order to protect the joint.
The question is, how do you prevent all of these issues to begin with? Or if you are already experiencing some of these issues now, how can you treat it? Well, there's really only one intervention that can address all of this, and that is a full body strength training routine. I'll show you why.
Strength training protects your joints, increasing and maintaining joint strength. In addition, increased muscle mass cushions joints so they won't be subjected to harmful stresses. Strength training lubricates joints, bringing blood and nutrients, helping to condition tendons, ligaments, cartilage, and connective tissue. Fibrotic scar tissue is replaced with healthy, elastic fibers. Strength training nourishes the entire joint and prevents and reduces existing pain through nervous system stimulation. Strength training causes the production of anabolic hormones and other whole-body health-enhancing metabolites, including growth hormone, testosterone, insulin-like growth factor, and myokines. These substances flow throughout our circulatory system, providing regenerative healing and preventive health powers. Optimal cellular health is realized with anti-aging effects.
I hope I have convinced you. I have seen far too much suffering from patients, friends, and family, and I've seen so many people lose function and lose mobility. And for those of you who think surgery is some kind of answer, I've got news for you. You have to work so much harder after surgery to get healthy. Physical therapy gets you started, but in order to truly maintain health in these tendons, ligaments, joint capsules, only you can do that, and only a regular strength training routine can do that.
Instructional strength training resources can be found at our website, preventive-health.org, and are also available on Preventive Health's YouTube channel. These free resources are produced by a medical professional and will guide you step by step in learning how to easily begin an effective strength training program. Understanding how to prevent and treat musculoskeletal problems is vital for maintaining function and mobility.